Good afternoon, everyone. We're happy to be here today with you and just want to thank you for joining us. I normally have the privilege of speaking with you about where we are in California's COVID response and come to know many of you over the last many months. But today, I'm here to talk with you about something that was in the plans well before COVID and frankly, proudly, never took a break during COVID, frankly, accelerated its movement, its purpose, and reason for coming together. And that is to plan what we call our master plan for aging in California. This is a plan that the governor boldly put forward, spoke about it as he campaigned to become governor, but then put into action in his first year and under the incredible direction and collaboration of many, many others comes together today. And we're here to share with you all of the good news and hope that comes in this plan. Before I begin, I want to just acknowledge the folks with me today, amazing leaders, amazing visionaries, people who've been at this cause for decades and have come together with us over the last many months to make this plan move from thoughts to paper and now to reality. First, I want to acknowledge the director of the California Department for Aging, Kim McCoy-Wade, who will be speaking with you shortly, joined also by two incredible elected leaders, members of the California Legislature, Assemblymember Nazarian and Senator Hurtado. Also joining us are three really incredible leaders well before this plan in the world of aging and disability, leaders not just in California, but nationally, really forefathers, foremothers of this entire movement across the nation to plan for all of us as our families, our loved ones, and ourselves age in California and across the nation. Jeannie Chen Hansen, Professor Fernando Torres-Gil, and Susan Damaris, all joining me, members of the advisory committee, our large stakeholder group that has been advising the administration on this plan. Next slide. So as I alluded to, it's hard to have any conversation today thinking about any of our populations in California, especially some of our most vulnerable, without acknowledging COVID-19 and the pandemic altogether, but also this moment of incredible surge in the cases across parts of California rising, and many of our care delivery systems really stepping up and working hard to take care of Californians who have become sick. You'll remember early on in March, the governor called one of the earliest actions in our pandemic response, all adults over 65 and those at risk to stay at home. And this was one of the first directions for a group of Californians to stay at home. And this was all intended, one of the first steps to save lives as part of this unprecedented, greater than 10-month COVID response. We know that at that time and throughout, older and at-risk Californians have answered the call. They've come together with their neighbors and the communities to work hard to bend the curve and to reduce infections overall and deaths. We know that older and at-risk Californians have been important heroes for their leadership and sacrifice throughout. The number of older Californians who have been leaders in their own families and communities, reminding people to stay at home, wear their mask, avoid going out when they can, not only to protect themselves, but to protect their entire families, loved ones, and communities. I would be remiss if I didn't also just say that older Californians, despite these incredible efforts, have been the group that has shouldered the burden almost the greatest in California. Not unlike throughout the nation, we have 10% roughly of all cases of COVID in people over the age of 65, while 75% of our deaths are experienced in that same age group. We know that COVID has been difficult, but at the same time, it has been an accelerant for change, an accelerant for hope. I think the stakeholder group that we have come together and worked with over the last many months have recognized this. They have seen COVID as an opportunity to not only address the immediate, but to make bolder, braver plans for a future, building upon some of the successes, some of the lessons in COVID to really accelerate where we're heading. And although it has been in some ways a dark time and a difficult time for many of us, the plan that we're unveiling today is the bright hope that I expect us to see more and more throughout the year. And it's a tremendous way to start the year. So without further ado, I want to turn it over to Kim McCoy-Wade to shepherd us through some additional parts of the presentation. Next slide.
Thank you, Secretary. And we very much do want to start, next slide, with the pandemic response, where we are all laser focused. I want to update you on work in several areas and then make sure that we share the resources again so that people know how to get help as we continue to stay at home to stay safe. So on the first front of finding information and assistance, our many helplines, whether it's our older adults helpline or 211, continue to get record calls. And a number one need is food. I am pleased and gratified to report that our aging meals programs have grown by 50% and served 27 million meals last year. Of course, we're also joined by the new innovative Great Plates partnership with local restaurants that served another 22 million meals. Our food banks are serving more than ever, and our CalFresh SNAP program is serving more older adults and people with disabilities than ever before, including adding online ordering and delivery to help make that food even more in reach. So those efforts continue. On the second front, staying connected and engaged, so important as we physically isolate that we try not to socially isolate. I'm pleased to report that our Friendship Line California is renewed January 1st, continuing service. We served 71,000 people last year who reached out for a friendly chat, for a phone call 24/7 in English, and increasingly more Spanish hours are being added, Spanish language hours, so that we can reach out and chat with the neighbor at any time, looking for that human connection. We've also worked hard to expand connections virtually and digitally and tried to close the digital divide. This month, we have tablets rolling out to our senior services, smart speakers rolling out, thanks to both new federal funding and private sector donation partnerships that we're so grateful for, so that we can support more older adults in staying connected with telehealth, with chats with friends and family, and a whole range of content that's only available online right now. The third front is our friends and family caregiving. And right here, we want to make a special focus on those of us who are friends and family with people living in nursing homes or assisted living. It's just been an incredibly tough time all around. And in California, we have really tried to keep visiting safe and possible with outdoor visiting and indoor large space when there's not a significant surge. Of course, given the significant surge, it's gotten tough again. We want to lift up the work, the long-term care ombuds who are returning to facilities safely and are there for residents' rights and to help with those connections. And I just have to thank all of the frontline healthcare workers and workers in these homes who are helping friends and family stay connected through cell phone calls and tablet video chats. These friends and family connections are so valuable more than ever. So much has been done and so much more is needed, but we are grateful that hope is on the horizon. As our secretary said, we have new federal stimulus funds about to roll out. We're hopeful about even more federal partnerships. And of course, vaccines are on everyone's mind and rolling out now. Next slide, please. We absolutely want to make sure that everyone knows about the resources available to them. These messages have been, are here on your screen. All of the phone numbers that are there, whether it's the 211 partnership who can connect you with community resources, our senior lines, our friendship line, but also if you're having trouble with fraud, there is a wonderful AARP Fraud Watch hotline here. Dementia is challenging so many Californians and family and friends, and Alzheimer's Association has a hotline. We want you to have all those numbers. And I just am so pleased that this resource card has reached more than 18 million Californians through a whole range of partnerships. AARP has mailed it out. We partnered with DMV to mail to everybody over 80. And our Medi-Cal partners have mailed it out twice, inserting it into an existing Medi-Cal mailing. And we've been able, with philanthropic support, to do radio ads in multiple languages and newspaper ads in LGBTQ plus newspapers. So really getting the word out to our neighbors and friends and family that let's stay connected, let's stay home, let's stay safe. So we hope all of those resources are helping us get through this moment together. But as our secretary says, we are going to get through this moment and come out of this stronger and more resolved to transform aging in California. We will do that based on all the resiliency we've seen from older adults, people with disabilities, families, friends, caregivers. We will absolutely address the suffering and the gaps and the inequities that have come through so strongly during this period. And we absolutely do this work in memory of all the lives that have been lost. They're in our hearts and in our minds, empowering this work forward. So with that, we're very pleased today to unveil the master plan, and I will turn it back to Secretary Galley to do the honors and kick off our discussion today.
Kim, thank you, and really just acknowledge your tremendous leadership at this moment for many, many months, and just really how you have come together and really led for the state in so many ways. I'm just very grateful for your partnership and your leadership. And really the work you pulled together for the master plan for aging, a whole of society blueprint was the vision, not just what can state government do, not just what can local government do, not just what can our nonprofit and philanthropic partners do, but what can every community and every individual across California do to make sure we're creating a California for all ages. We started many months ago with our Engage campaign, one that brought and invited all Californians to participate in this conversation, the numerous stakeholder groups, the numerous forums across the state, the many roundtables I had the privilege to participate in from Southern to Northern California, some in person before the pandemic, many virtually after we started, really to unveil what has become a tremendous effort and plan that we're going to share today. We'll focus on these 5 bold areas. Each of our stakeholder advisory members are going to share a little bit about the plan, about what we intend to do, both immediately and over the next couple of years, and really to build the runway for a California for all ages that I think we can all participate in, that we must accelerate to get there, that it's going to take each and every one of us to do that. So with that, I'm going to turn it over first to Professor Fernando Torres-Gil to share the next slide.
Thank you, Secretary Galley. This chart here on a changing California is our demographic reality. This is what we hope, this is what we would like to see, and that is to live a good, long life. In part, we now have this wonderful longevity dividend opportunity to live longer than ever before. In fact, the average life expectancy in California is close to 82 years of age, and it's the second highest life expectancy in the country. And that is the good news. The challenge which this master plan intends to address is that not all of us enjoy this life expectancy. It varies by gender, by race, by income, by education, by geographic zip codes. Many of us get to live a good long life, well beyond 82 years of age. a good number of us, sadly, will not enjoy that long life expectancy. COVID has brought out this tremendous inequity and disparities in this life expectancy, where Black and Brown communities, for example, have a lower life expectancy than other groups. Those with higher education can live a longer life. Those with lower education will have a lower life expectancy. So this is the challenge and the opportunity. And our master plan, in part, is to lay out that roadmap, as the Secretary has explained, for how we can, in the future, move well beyond COVID and the inequities and give more of us a longer, healthier life expectancy to at least 82 years of age and even to become centenarians. The next issue to address in this demographic destiny, on the next chart, please, is that we're also a very diverse population. And that, in fact, is where California has a competitive advantage. We are the most diverse state in the country in terms of size. As we can see here, we're diverse by ethnicity and race and immigration status. We're also diverse in terms of households and family arrangements. We're certainly diverse in terms of the ability to have multi-generational members in our household. And so our state, which is now a majority minority state, is where the rest of the United States of America will be moving. By 2050, no one group, by 2060 certainly, no one group will be a majority. All of us will be a minority, whether we're non-Hispanic white, Asian Pacific Islanders, African Americans, Latinos, Hispanics, multiracial. But that is where the master plan also gives us a tremendous opportunity to show the rest of the country that we can plan for a longer life expectancy, a healthier longevity, and we can address the racial, ethnic, immigrant opportunities and challenges to ensure that all of us in a multiracial and diverse population have equal opportunities to live that good long life. But we are not alone. We will now have partners at the federal level in the executive branch and the congressional branch. And California, as it has for many, many decades, can once again be a leader, an innovator, to show the rest of the country how we can take advantage of our diversity and our longevity. And the Master Plan on Aging is an amazing opportunity and a roadmap to become the innovators and to prepare for a longer, healthier, diverse lifestyle. And to discuss more about the role of that Master Plan and how we have brought together our diverse stakeholders, I now turn it over to Susan Damaris, who is with the Alzheimer's Association. Susan?
Thank you, Professor. Well before COVID-19, California was experiencing historic demographic changes. Our state holds the distinction of having the largest aging population in the nation. Governor Newsom and his administration recognize the scale of the challenges our communities are facing. Together, we've crafted inclusive strategies that all sectors will need to build the California we imagine, where people of all ages and abilities are engaged, valued, and afforded equitable opportunities to live how and where they choose. The master plan's thoughtful and deliberate development reflected this open and inclusive approach. Over the past year, we benefited from genuine public engagement, intentional stakeholder outreach, and robust community roundtables with legislators. The final plan was strengthened by close collaboration with the Governor's Task Force on Alzheimer's, led by Maria Shriver, aligning our shared values and goals. All told, more than 1,000 public comments were submitted to the administration, along with 240 policy recommendations from stakeholder groups. This not only informed the process, it grounded the work in the real experiences of millions of Californians. This fall, the Master Plan Stakeholder Advisory Committee produced their final report, which included 800 expert recommendations. This substantive work was complemented by targeted proposals generated by the Alzheimer's Task Force. Remarkably, all voices reinforce the important work of the task force: a dementia-friendly workforce, culturally responsive diagnosis and care planning, affordable care, and targeted research focused on women and people of color. The Master Plan for Aging was made better still by the work of the governor's cabinet. 10 cabinet secretaries and their agencies were actively engaged and personally committed to the comprehensive report we're all seeing for the first time today. This unified, coordinated effort has produced a framework that is both deep and wide. The master plan reaches deep into our communities and extends widely beyond government to engage multiple sectors, new partners, and traditional allies to truly reflect a California for all. Next slide, please, where Jenny Chen Hansen, the former CEO of the American Geriatric Society and the founder of Unlock, will continue.
Thank you, Susan. It's incredible to have this opportunity to come with my colleagues and before all of you to lean into this exciting effort that has culminated from the work that Susan has described, bringing together so many different sectors. This wasn't an approach where one group did one part and another part, and this is not just baton passing. This was a team, a sports team that's working together for the ultimate goal of being able to have a plan for the next decade to care and elevate the benefit of aging in our state. And in particular, I'd like to just make the note once again that this is a master plan for aging. As Secretary Galley mentioned earlier, that this is a runway. And so this is not just about people who are older. This is about all generations. And some of the recommendations really will raise the elements of intergenerational opportunity. So I have the privilege of saying, after all these 1,000 emails that we've gotten, the recommendations that came out of the stakeholder committee, amounting to over 800. How do you begin to address that? So you heard that the cabinet has really distilled this to 5 main goals. And I'll read them really quickly first and just say a word about each one. The first goal is housing for all ages and stages. And so this addresses the important component of shelter, affordability, mitigating homelessness, thinking about living environments that are about older people and families and younger people. Second, health reimagined. When you have a chance to view this particular goal, you'll see how extensive this is. The stakeholder group really did a tremendous amount of work about our infrastructure of long-term services and supports, but it also did a great deal of work on well aging. You'll see that incorporated under this particular goal. The third one, inclusion, equity, and not isolation. Professor Torres Gill raised this relative to making sure that we embrace all of those in our society, as well as recognizing so many of us have periods of isolation and loneliness. You'll see that appear here. 4 is caregiving that works. There is probably hardly any among us who've not been touched by this, with people that we know who have needed and benefited from caregiving, both from their family and friends, but also those who are paid staff to do this. And then last, alluded earlier, is the ability to afford to age with dignity and wellness. So the whole component of financial aspects. So what I would just add to goal 1 is that we have a chance to live where we choose in all the communities that are age, disability, and dementia friendly, and plus being ready for climate change. And secondly, with the Health Reimagined, we really want to optimize our quality of life. And so that's, again, staying well, but when we need services and care, that an infrastructure of services will be present. Third, our ability to be included and not be invisible. So many of us find that people talk about being invisible as we get older. Here, there'll be more opportunities that we will promote for active work, volunteering, the ability to learn leadership skills at every stage of life, and the fact that, as Professor Torres-Gill said, to avoid the traits of discrimination, abuse, and neglect and exploitation. And relative to caregiving, I think I have conveyed how important that is, but also to recognize the rewards that are possible, along with how to mitigate challenges. And then finally, to make sure that there are ways that we can undergird the financial security so that people do know that they can afford to age. So one of the things that I wanted to convey is that because the cabinet has been so invested in working with our report, they as a group have come up with 100 ready initiatives that are ready to be deployed. So this is not just a paper that gets put out with all these wonderful goals, but when you go to the website and see the report, there are over 100 initiatives with names of departments within the cabinet that are attached to them. And this will show up in our data dashboard that you'll hear for accountability a little bit later. So this is a plan for 10 years, and you'll see that these initiatives will begin for really focusing on the first 2 years. Next slide, please. So how do we go about doing this? It's wonderful to have these initiatives with accountability and named departments to it, but what does that mean for us on the local level? On the local level, we'll have a chance to really give a blueprint of what can we do. So this is kind of like you might consider the early ingredients of what is possible that comes from the state, comes from your community, comes from some of the organizations that volunteer. How do we begin to put this into action? So as a result, there will be local playbooks that are starter kits for all of us that we can customize for our communities, whether we're in large cities, suburban areas, or in the rural settings. So with that, I would like to make sure that you know that this is all now up on our website as of this hour. And I will turn this back to our Director of Aging, Kim McCoy-Wade. Thank you.
Thank you so much, Jenny Chin Hansen, and all of our stakeholder partners. And I do want to get to our legislative partners very soon, so I will be brief, but I do want to highlight on this slide, you talked about the local playbook, but two other really important pieces of how we're all going to keep our commitment for this not to be the plan on the shelf, as the governor has charged us. One we've heard about, and I hope you are able to see on the website now in our report. Yes, it's a 10-year plan, but we have initiatives that we believe we can tackle right now, not just despite the pandemic, but in fact because of the pandemic and so much more. And while we have our over 100 ideas that were culled from our cabinet and our stakeholders' best thinking, they absolutely depend on partnership with legislature, local leaders, and all stakeholders to prioritize and implement together. So really look forward to digging in with everybody on these initiatives, planning to convene us all virtually very, very soon to start getting to work. And then lastly, another equally important part on the next slide of this effort is the brand new data dashboard for aging, built out by our partners at the California Department of Public Health Let's Get Healthy initiative. If we're going to hit our goals of California for all ages by 2030, we need to measure them, and we need to measure them by place and by race and by a host of equity measures. So you'll see on this dashboard, which you can get to either through the master plan webpage or the Let's Get Healthy webpage, you can see all 5 of the goals and a series of data-driven indicators behind them that you can, at the state level, at the local level, and by different communities, measure our progress. And as the team says, we aim to be transparent and accountable. and continuously improving. So you will see updates to this site as more data becomes online, such as the new state homeless data set this spring, and so many more. So look forward to continuous improvement on all fronts with this era. With that, I think we do want to turn it back to our secretary for the rest of our conversation. Thank you, Secretary Galley.
Kim and others, thank you so much for really laying out the details. Exciting to see. Before turning it over to Senator Hurtado to say a few words, just want to acknowledge two other people. One at my agency, Marco Meach, for his tremendous leadership getting this started, working with a number of individuals to really put together the groundwork that got us here. And then Richard Figueroa in the governor's office, a tremendous leader for so many things, but really his role in helping keep everything going and moving along, supporting Kim and a number of others. I just think it's been a tremendous effort, and so many efforts like this one don't go as well. And that's really a reflection of not just the all of government approach, not just my fellow cabinet secretaries, not just the tremendous leadership of Kim McCoy-Wade and our incredible advisors and stakeholders who met hours upon hours, many emails to put this plan together, but really because of the partnership with our legislature and those leaders. So without further ado, I want to turn it over to Senator Hurtado, who I had the chance, the first roundtable around aging I did with her in her district, sensed her tremendous leadership, her passion for this work, her ability to bring community together, to have important conversations was evident there. And it's a real privilege to be with you again here today. Senator?
Thank you, Secretary Galley, and good afternoon, everyone. It's a pleasure to be here with you all today. I'd like to thank Director Kim McCoy-Wade and, of course, Secretary Galley, and especially Governor Newsom for including me in today's release of the Master Plan for Aging, but also for elevating the needs of older Californians. When he announced the intentions to develop a Master Plan for Aging, we had no idea that a global pandemic was looming and that it would touch every aspect of our lives. As chair of the Senate Human Services Committee, I was the first of several elected officials to co-host with Secretary Galley a series of roundtable discussions during which local community leaders were asked to share their insights on what the plan should entail. In Bakersfield, we convened a roundtable that included local businesses, labor, and community leaders to discuss older adult employment and workforce issues. Several of my colleagues, including other members of the Senate Human Services Committee and the Senate President Pro Tem Tony Atkins, also co-hosted similar events in their districts that focused on social isolation, housing, transportation, and long-term services and supports. The input provided at those roundtables informed the content of the Master Plan for Aging being released today. Sadly, we know that many older Californians don't utilize or have access to the wide array of public programs and services that are designed to help them. And this plan is intended to fix that by serving as a blueprint for communities all over the state to build environments that promote an age-friendly California that meets the needs of our older adults. As chair of the Senate Human Services Committee, I'm particularly interested in lifting and improving the programs that feed and provide services and support to older Californians and their caregivers. These programs must be person-centered and integrated in a way that makes them easy to access and simple to navigate. The work that went into developing this plan is just the beginning. It will take the ongoing collaboration of all stakeholders across many sectors, including those who provide healthcare, housing, nutrition, and caregiving, to see that the needs of our aging population are met and that all Californians can age with dignity. COVID-19 pandemic has highlighted the urgency of this issue, and now it's time to roll up our sleeves and get to work to ensure that we build a California for all ages. I look forward to working with the administration, with stakeholders, and my fellow legislators to make that vision a reality. Thank you for the opportunity to be on this Zoom call today.
Thank you, Senator. I wanted to now turn to Assembly Member Nazarian to say some words as well.
Thank you, Secretary Ghali. First of all, just wanted to say thank you to Governor Newsom for activating this critically vital issue area, which has remained neglected for a very long time, or at least not highlighted the way it should have been. Second, thank you to Secretary Ghali for engineering the governor's vision. And then last but not least, thank you to Director Wade for being such a wonderful advocate and implementing this plan. Just to reiterate some of the things that have been discussed. First of all, California's 60-year-old plus population is on trajectory to make up 25% of the state's population within the next 15 years. Second, during this pandemic, we saw that California's 65-year-old plus population, which makes up 10% of the state's population, contributes 75% of the state's death, as Secretary Ghali had pointed out. And these disparities have been exacerbated within the minority communities even further. That's why it's critically important that we take these steps in not only addressing the long-term needs of our seniors, but making sure that we implement plans that ensure that we never have to deal with frailties such as we did in our systems during this pandemic that was clearly amplified. So I wanted to say thank you for bringing this master plan forward. I want to say, as we're working through the master plan, working with the administration and collaborating with the legislature to provide legislation, oversight, and working alongside our advocates to ensure that the budget also reflects these priorities. I want to say how thankful I am of the process that this administration brought forward, because by bringing all the various groups, an inventory of different needs and a myriad of different advocates into this, you've helped create a coalition that was also extremely powerful in making sure that this current year's budget what reflected the needs of the aging population of California. So thank you again for all the work that's done. But this is, as was said before, this is just the gunshot that starts the sprint now for our upcoming marathon of making sure that we implement these plans collaboratively. Looking forward to working with all of you.
Thank you, Assembly Member. And I just want to say, by way of closing, before we turn it over to reporters for a few questions, think you heard that there is power in planning, power in partnership, and there's no intention to rest on our laurels. This is a document that will live. This is one that will be used to build that pathway, build that runway to what is a decades of work in front of us, starting now immediately with initiatives over the next 2 years that are focused on all of the things we've talked about through this pandemic, but we amplify more today, that we accelerate towards change, that we can't wait, and we're going to move quickly with all of you. And what's exciting about this plan, almost more than other plans that I've participated in, is there is something in it for everyone. There's something for all of us to do, all of us to consider, all of us to reflect on, but mostly a great deal of action and focus. And so with that, just want to thank you all for joining and turn it over to questions from the media.
Adam Racusin, ABC News. Adam Racusin, ABC News.
Yeah, thank you. Thank you, Dr. Ghali, and everybody for going through all of this and this helpful information. Dr. Ghali, I imagine everybody getting to this needs to be healthy to pull this off, and Californians have criticized the rollout of the COVID-19 vaccine. A lot of doses received, nowhere near that administered. Why is it taking so long to get people the vaccine, and how does that change?
So again, really wanting to focus today on our master plan and setting up an opportunity to talk about vaccines later in the day, and look forward to that with a number of you and you know, the tremendous work both at the state level, our partners in the county, not just at county government, but throughout our healthcare delivery systems, our nonprofits, our employers, really bringing a number of people together to accelerate the distribution and getting vaccine out to our communities, and really do look forward to speaking about that later on today.
Ron Lynn, Los Angeles Times.
This is Ron with the LA Times. Dr. Galley, you know, we're just now learning that Methodist Hospital in Arcadia has convened a triage team, and it notified the State Department of Public Health on December 29th that it was implementing crisis standards of care, but hasn't yet found the need to ration any care. We were surprised by this because the county said on Tuesday that no hospitals in the county have declared they are in crisis standards of care. So my questions are, did the state receive such a declaration from the hospital on December 29th? And if so, why wasn't that information released, and why wasn't the county notified? Are you aware of any changes in policies in LA County that will seek to decompress Methodist Hospital? Have other hospitals in California told the state they're implementing crisis standards of care, and will that information be made public? And finally, are you concerned that hospitals are descending into crisis standards of care without bothering to make a declaration? We're hearing of a situation where there are already arguments over whether to give the few remaining ventilators to an elderly patient. Thanks.
Yeah, thank you for raising what is certainly a challenging issue and moment. I will say that we can get back to you with specifics on facilities that have let us know at the state level. I don't know every facility that has let us know that. We do ask that at the same time that the notification is made to the state, that local public health is also notified of any similar needs by any facility. And I'll just remind you that really, and this is something that Director McCoy-Wade played a key role in, we've worked over the last many weeks, frankly, many months, you know, back to the spring and summer, to release guidelines and crisis care approaches, really thinking about this across a continuum, knowing that there isn't a single moment that a facility or a community crosses into crisis care, that we work through contingent care into crisis care. And so we know that in Southern California, LA County in particular, that many challenges, making sure that we have enough staffing to take care of the needs of all the patients, that we're using our space effectively. And you've heard the stories about using spaces that are not normally patient care spaces now deployed to take care of some critically ill patients. We have not, to this moment, heard that any facilities are making decisions between which patient needs or should receive a ventilator to keep that person stable and alive. However, we have worked hard to make sure that we have ventilators and other supplies deployed throughout the state, but particularly now in Southern California, to make sure that when a facility does need such equipment and supplies, that we can try to provide it right away. But I do not want to ignore the criticality of the situation. The fact that we have hospitals who really are dealing with crisis situations. They're making difficult decisions. They are exhausted. They are working hard to meet the needs of Californians. In particular, many older Californians who need that level of care, apropos today's conversation, are finding care in those facilities, and we expect to do all that we can to make sure that they can support it. To your specific questions about specific facilities, happy to hear which ones those are and confirm any information that we can. Thank you.
Rachel Bluth, Kaiser Health News.
Hi, Dr. Galley, thanks so much. I know you don't really want to talk vaccines right now, but what is the plan for how to reach people who don't have a lot of contact with medical institutions, like those who are uninsured or don't have primary care doctors or don't go to hospitals. And then also, because we're talking about master plan on aging, what is the plan to get vaccines into assisted living facilities who are having some trouble, who are smaller and not getting the same resources as skilled nursing facilities right now?
Yeah, so again, look forward to having a deeper, fuller conversation on vaccinations later, but very quickly, throughout many of our partnerships, this is through employers of many of the essential workers, community groups, community clinics, a number of partners that we depend on to deliver care of all varieties all year long for many, many years in the past. We lean on them now. We work with them now. We partner not just with our local public health partners, but local community clinics and others to ensure that all the populations you mentioned have the information and the ability to, when their sort of community, when their ticket is up, as some people say, that they have the information they need to be able to access vaccination. But we also hope that in the meantime, that those who need clinical care, that are experiencing symptoms, use those same resources, those same access points to be tested, to receive care, hopefully well in advance of when you need hospital level care, so that we can both protect you, protect your community, provide that needed care to avoid the eventual need for a hospital bed. So all of that we hope is in place today as we work to make sure that vaccine information is distributed through those very traditional, tried and true approaches.
Final question, Christine Myduke, Wall Street Journal.
Hi, Secretary Galley. Thank you so much for taking our questions. I just wanted to follow up a little bit on Ron Lynn's question. We understand from over the weekend that the state said 3 hospitals had entered crisis care or had notified state officials that they were in crisis care standards. And I'm wondering what that current number is, how many total have informed the state that they entered crisis care. And in addition to that, I believe your statement to us said that with state intervention and assistance, that those hospitals were no longer on crisis care. Methodist Hospital of Southern California told us this morning that they have not exited crisis care standards. Can you clarify that? And also, in regards to the requirements that hospitals need to post their crisis care guidelines as of today publicly, and what they're going to be following. If you could give us an idea of whether there will be some kind of transparent state portal or website where the public can see whether the local facilities are indeed in crisis care when they exit crisis care standards, and how that information will be distributed. Thank you.
Sure, yeah, and thanks for the question. And just to underscore, I can update you separately if additional facilities have notified us that they've crossed into crisis care. And just again, remind you that that designation is important at a facility level, but that communities who are experiencing this crisis, many facilities are making difficult decisions, working hard to prevent getting into crisis care. Later today, the CDPH website portal will be live. Some of the information that you're asking about will be posted, but also we ask you to we've asked every facility, as you've already pointed out, across the state to post their own guidelines. They could be the unique guidelines of that facility, exactly what efforts are in place to plan for crisis care, but then how their facility will approach being in a crisis care posture. We've asked facilities to post their own plans on their websites as of today. In terms of addressing the specific needs, as soon as we hear about a facility, even before they get into crisis care, we've spent quite a bit of time in the state partnering with the county, partnering with the health systems over the past 2 weeks here in Los Angeles, moving and working also in San Bernardino and Riverside, 3 deeply impacted counties that in many ways are working together, hospitals in an unprecedented way, sharing resources, making sure that staffing is equal, working with our EMS agency here to ensure that patients are initially brought to facilities that have more capacity, are a little less overwhelmed than some others. So all of those details are in place. Methodist, other facilities that you mentioned, as well as a host of others, are constantly in communication about the data, working not just with the state, but also with the county to make sure that patients, when they do arrive to receive care, that we're most well positioned to support them. We will, as I said, intend on this web portal that will be up today on our CDPH website, allow you and many others to see exactly which facilities we're focused on, which facilities have notified us, and a host of other efforts to continue to work to keep every facility planned for crisis care, but out of crisis care and contingency care in some of our hardest hit communities. So I know that there's so much to talk about and so much to say. I look forward to continuing that conversation in other forums. Want to just end by thanking just the tremendous number of individuals who have come together to put this master plan in place. As you can see from the questions and the interest, it's hard to separate anything from COVID today. And the master plan intends to not just address some of the acute needs of older Californians who are aging so that they can be safe and secure in this pandemic, but that at the other end of this, we come out with the vision, the resolve to continue to recover well and to make California a California for all. So with that, thank you and have a good afternoon.